The beginning of vascular imaging actually occurred 3 months after Wilhelm Röntgen discovered the X-ray beam in 1895. Two scientists by the name of Haschek and Lindenhout injected a radioactive element into a cadaver hand and were able to visualize its blood vessels. This led to the discovery of the human atlas through blood vessels. The development of contrast media and other imaging modalities such as CT, MRI, nuclear medicine, and ultrasound have permitted the minimally invasive techniques applied today. Physicians are able to identify, treat, and monitor recovery while actually being able to view the progression or regression of the disease in real time. Interventional imaging requires advanced radiographic and fluoroscopy equipment. This includes tubes that are attached to the ceiling along with a C-arm or an L-arm. Specific to interventional radiography, a small focal spot and a large anode disc are necessary components of the X-ray tube to accommodate for the increased heat load and to increase spatial resolution needed for imaging smaller vessels. High-frequency generators are required to produce electrical currents with a voltage ripple of 1%. This ensures the X-rays produced are 99% pure energy and will yield a quality diagnostic image. This allows the display of the image on a flat panel TV monitor. The image intensifier tube is used to increase illumination of the image and to make a wide range of contrast more visible. KVP, MAS, and patient thickness influence how much illumination may be produced. The image intensifier essentially increases the amount of output photons performed in a series of steps to increase image brightness. Magnification also occurs in the image intensifier. For example, increasing magnification will produce a smaller field of view, but increase patient dose and reduce brightness. This is a brief overview of X-ray production and imaging acquisition. The electrons are accelerated with high voltage from the cathode to the anode. As the electrons collide with the focal spot on the anode disk, X-ray photons are produced. The intense X-ray photons then travel through the patient. Once the X-ray passes through the patient, photons that are now remnant determine what is displayed on the image receptor. Once the X-ray photons hit the input screen of the image intensifier, they are converted to light. They hit the photocathode, where they are converted back to electrons. The electrons are accelerated through the electrostatic lens to the anode. They travel through the anode hole and are converted back to light at the output screen. A television camera then takes the output photons and converts them into an electrical signal at the signal plate. The television camera directs the signal to a flat panel image display where the image is now shown.
Interventional radiology suites have a different variety of over-the-top technology equipment, which include surgical instrument tables, perfusion systems, anesthesia machines, hemodynamic equipment, and most importantly, angiographic tables, which are stationary patient couches that have a floatable or movable tabletop. Types of interventional procedures include carotid artery narrowing. Though the plaque can increase risk of stroke, it can be treated with open surgery. An alternative to surgery is a carotid stent. A metallic mesh is inserted through the blockage. Cancer is also treatable. In this picture, you can see a liver tumor. A catheter is inserted directly into blood supply, where microscopic beads are delivered with chemotherapy or radiation. Deep vein thrombosis, or DVT, blood clot in the veins. Treatment to dissolve dangerous clots. Risk of arteriography includes low blood pressure, heart attack, and stroke. Three widely used techniques for arterial access involve access through the femoral, radial, or brachial artery using different types of catheters, which include Simmons, Hink H1, Cobra C2, Pigtail, and Berenstein. Once the catheter is in place, a guide wire allows the radiologist to position the catheter within the vascular network, and contrast media is injected with a control panel. Patient preparation for the procedure includes: do not eat anything after midnight prior to the exam. All patients please arrive 30 minutes before the scheduled exam time. List history of medications to prevent allergies or adverse reactions to contrast media. NPO instructions include: only patients who will receive sedation or anesthesia during the procedure need to be NPO. No solid food or milk products for 6 hours prior to the procedure. No clear liquids for 2 hours prior to the procedure. Take all regular medications as scheduled with small sips of water unless otherwise instructed. Digital angiography subtraction is a type of fluoroscopy technique used in IR to clearly visualize blood vessels in a bone or dense soft tissue environment. A pre-contrast mask image, which shows a distracting background image, is subtracted from a post-contrast image obtained at the same location. The result is an image of only contrast material-filled vessels. Post-processing for digital imaging is a technique better known as windowing. It's intended to adjust contrast and brightness of an image. Window width adjusts image contrast, and window level adjusts image density.